Welcome back, Health Impact audience. We have talked many times, and especially in our last Health Impact, we had Chris Ross and a number of other CIOs talking about how important it is to really treat the patient as a partner, and in which we're not doing things to the patient, but we're doing things with the patient. And for that, we've got a really, really good speaker. Emily Dumas is going to talk to us a lot about how to make sure that when you're interacting with patients, you often hear us thinking about consumer-oriented healthcare or retail-oriented healthcare. That's absolutely the wrong way to look at things, because people are not coming to stores to buy shopping for clothing and that kind of stuff. So how do you actually get patients to believe that they are part of the care and that they are partners with the physicians and the nurses and the administrators in a hospital setting and in a healthcare delivery setting? That's what Emily is going to talk to us about. And after her presentation, I'll ask her a few questions about how to actually put a lot of what she's talking about into practice. So with that, Emily, I'd like to have you join us. Go ahead and show your presentation. Give us a quick intro about you and what you do at the University of Alabama Birmingham Medical Center, and take it away from there.
Great. Thank you so much. Are you able to see my screen okay?
We do.
Wonderful. Okay, so like you said, so hi all, my name is Emily Dumas. I am the Manager of Care Transitions at UAB Hospital located in Birmingham, Alabama. Today I will be talking about patients as partners through my experience utilizing the Emmy program here at UAB. For those who are not familiar with UAB, we are the University of Alabama at Birmingham. We're located in Birmingham, Alabama, great center of our state. So UAB Medicine is one of the top academic medical centers in the United States, and it's also Alabama's largest single site employer. In addition to providing healthcare services for more than 1.6 million patients annually, we are committed to educating medical professionals and advancing medical science through research. UAB Medicine is anchored by UAB Hospital, which has been named one of U.S. News and World Report's best hospitals. We're also the #1 best large employer for 2021 by Forbes magazine. So it's a wonderful place to work, and I'm very honored to be speaking on behalf of it. Okay, I want to give a quick overview about UAB beyond what I've already said. So UAB Medicine is recognized as a magnet designated organization. We're in our 5th year, so we're hoping to go for 6. So we're very proud of that credentialing. We're one of only 21 hospitals with worldwide with that designation, so we're very proud of our status. UAB Medicine is also designated as a healthcare equity leader by Human Rights Campaign Foundation for demonstrating leadership in the LGBTQ healthcare and employment. So we're an equal rights employer, and we hope that our patients, employees, and everyone get to see that we are excited and doing wonderful work here. Some other acclaims are listed on the screen. You can see that we have a Vizient Reward for supply chain excellence. And also we have over 350 doctors that are rated as the best doctors in America serving us here at UAB. So we're very excited about our physicians, and we hope to bring great programs to our patients. So our topic today is how we support, engage, activate, coach, and ultimately partner with our patients. The way we achieve these outcomes is through a multimodal approach to patient engagement and communication. We provide technology-based communications that are designed to activate and empower our patients. And again, we do this through multiple modalities. We use phone calls to collect patient information or to schedule appointments and close gaps in care. We also use web-based programs to educate patients and their family members and caregivers to support those shared decision-making and provide a documented report of the patient's education pathway. We also use all of these mechanisms to help monitor our patients post-discharge, to coach them and help them self-manage their conditions, and to identify those at risk so that we can reduce readmissions and hopefully lessen length of stay in future admissions. Through our partnership with Emmy, we have deployed the right solutions at key decision points for better experiences and outcomes. And if not just knowing we're delivering trustworthy content with behavior-based delivery, we also hope to deploy tracking tools and leverage analytics to provide key insights as the patients struggle with decisions during the care process. To that end, I'd like to do a deep dive into 3 case studies that we have done here at UAB. to be able to show tangible, measurable impacts that we receive from IMI and how our patients experience the process here. So documenting which patients receive an influenza vaccine is critical. I'm sure anyone in healthcare or even just having children growing up has experienced what it's like to try and get a flu shot for everyone in their families. But with retail pharmacies and urgent care clinics also offering flu vaccines, it can often be difficult to ensure that a patient's flu vaccine status is reflected in their electronic medical record. Often this is because the patient either did not receive a flu in the first place or they were done somewhere outside of the system, so they're not connected. So at UAB, we knew that there had to be a better way to manage this process. We had over 54,000 patients yearly come in, many of whom had not had documentation for having a flu shot, but might have stated that they had it in their medical records. So we turned to the IMI platform and said, what can we do better to try and track these for our patients? So with their help, we were able to create a patient engagement program to help educate patients and raise awareness about getting the flu shot, where they could get it done, and then reaching out to those patients to have them confirm whether or not they did or did not receive it. So in less than 85 days, we were able to update patients' vaccine documentation and provide flu status for over 13,000 patients. So about 24% of our patients engaged with the calls and let us know where they were at with their flu series. So we're really proud of those results. It's wonderful to see our engagement do what we wanted it to do and be able to reach all those patients and make sure that we're providing the best care for them at that point. And then our second case study is about our GI group. And so they had an overall goal for the year to reduce GI cancellations. So health professionals administer preventative screenings and services to assess and reduce your risk of health disease and conditions such as colorectal cancer. In the long run, it's more cost effective to take steps to prevent disease and than pay for treatments. As much as $3.7 billion in medical costs could be saved annually in the United States if preventative screenings were increased, according to the U.S. Office of Surgeon General. So poor patient education and understanding leads to poor compliance, which results in cancellations for scheduled colonoscopies. So UAB challenged IMI to help them reduce the cancellation rates for preventative GI procedures. So using IMI to help educate our patient populations about the importance of upper GI endoscopies and or colonoscopy procedures helped to improve our patient outcomes. So each patient received an IMI access code and instructions in how to view the education online through either a smart device or a tablet. And for patients who did not have smartphone access or internet, we were able to call them and provide those updates over the phone. But the overview is that our patients were able to receive the education at the right time in the right place in the way that they wish to receive their education, to hopefully get them inspired about taking care of themselves and engage in their own healthcare journeys. So the results of this were among the 4,144 patients who were assigned to the program during this case study. So among the 4,144 patients who were assigned an IMI Engage program with an appointment for an upper GI endoscopy or colonoscopy, the results showed that those who did not engage had a 12% cancellation rate, and those who engaged had a 3% cancellation rate. So patients who engaged with the services were able to decrease that cancellation rate by over 9%. And so we saw that more patients, we had a 75% reduction in patients not canceling their appointments. So at the end of the study, it was determined that patients who engaged with an IMI program were less likely to cancel an endoscopy or colonoscopy appointment. So this is still in utilization today. We continue this process to make sure that our patients are able to receive their education so they can bring questions back to their doctors whenever they have their appointments. And then we follow them through their actual procedure to make sure that if they have any follow-up questions, we're there for them and we can answer questions outside of the hospital to prevent any unnecessary readmissions. And then for our third case study, this one is about scalability and efficiency at UAB Hospital as a whole. So discharge patients need to be consistently engaged throughout a care transition in order to have the confidence and ability to successfully manage their health at home. This is critical for managing performance, reducing readmissions, and managing patient throughput. However, this does require hospitals and health systems to find effective and scalable ways of monitoring and intervening with patients in need and empowering those patients to be able to self-manage for themselves. So UAB again challenged Emmy to say, what can we do about this? Is there a way we can utilize Emmy to help these patients? Our goal was to reach patients after discharge, to reduce staff time spent connecting with low-risk patients, and to help discharge patients self-manage those chronic conditions. So we developed the ME transition program to extend the reach of care team beyond the clinical care setting. So we encouraged self-management, we motivated positive behavior, and we alerted the care team of people who may be at risk. So we currently utilize multiple ME transition series to target both the general discharge patients, as well as patients with chronic conditions such as COPD, heart failure, pneumonia, AMI, and a few other diagnoses that we want to track outside of the hospital. So the results of the study, so before Emmy, UAB had nurses that would call patients after discharge. So we were only able to connect with about 66% of our target population. So we had multiple nurses calling patients through their average workday, where you, I'm sure, can imagine that not every single patient engaged with the call. So many calls were spent with the nurses leaving a voicemail or having to list them as a reconnect later. So by implementing ME transition to scale the care management process, more patients were reached post-discharge. Post-ME, nurses combined with ME connected with 21% more patients, reaching 80% of UAB's target population. And while ME is not able not only to connect with more patients, but also spend more time on the phone with them since the calls can continue. So this has been a great benefit to us because not only does the system do the heavy lifting for us, but it allows the nurses that when they need to call patients back, they're connecting with the patients who need us most. So this call series is able to connect with those patients, to connect with red flags. So if there's something going on, we need to know about it. We can have a real nurse call the patient back either same day or next day to check on those issues and hopefully prevent readmissions. So not only were nurses able to reach more patients post-discharge, but they were also able to provide more immediate interventions for those in need. ME transition asks patients certain questions to identify any potential concerns. This information is delivered back to the clinical staff, alerting care teams of the patients who may be at risk. So before ME, 5.2% of nurses calls were made to patients with issues. With ME transition staff, resources were allocated to the patients who need it most, and 100% of calls nurses were made were to patients with issues. So we ultimately saw an increase in nursing satisfaction as well because they were able to utilize their nursing skills to be talking to patients with every single phone call, not just in attempts. This was so successful at UAB that we have expanded the use. So from September 2015 to June of 2018, the ME transition series made over 407,000 phone calls that did not result in a red flag. So by allowing staff to focus on those follow-up calls that had red flags, we were able to save the equivalent of 1.5 full-time employees per year. And we've seen that grow even since then. This is probably my favorite program that is in utilization at UAB right now. So I'm very excited to hopefully expand this in the future. And then many hospitals and healthcare systems struggle with effectively managing the health of the discharge populations. Managing recovery, reinforcing key information, and motivating behavior change are essential to avoiding complications in readmissions. The Hospital Readmission Reduction Program, HRRP, penalizes hospitals with high readmission rates, giving hospitals a financial incentive to lower their readmission rates. So ME transitions was also associated with better performance in this area. So Medicare patients that did not engage with ME transition had a 19.4% readmission rate compared to the 15.1% for those that did engage. So UAB saw a better performance with readmission rates for patients with chronic conditions such as heart failure. And those heart failure patients that did not engage had a 24.8% rate compared to the 18.2% that did. So overall, we're seeing across the care continuum that patients with chronic conditions and then just our general discharge patients, those who don't have a diagnosis but discharged from the hospital that we want to be following up with, all sorts of patients benefited from these kinds of call series. So as you can see, we were able to help UAB meet its goals, or ME was able to help meet those goals with a scalable solution that optimized the workflow and improved utilization of hospital resources. And these improvements contributed to the enhancement of patient and staff satisfaction, and were also associated with the reduction in readmission rates. So these were just 3 examples of the power of engaging patients at key decision points for a better experience and outcomes. So our goal from population health standpoint is to keep the patient well at home and prevent any unnecessary readmissions. We want to meet the patient where they are, where they're at, wherever they need it. We want to be the full force for them to follow through and make sure that they have everything they need in their medical journey. But I want to say thank you all for listening today. I appreciate your time. I have listed my contact and Emmy's contact on here should you have any questions or wish to have any sort of follow-up, and I am open to some questions.
All right, fantastic. So we will be, of course, getting questions in the chat, Emily, while you're talking up here. So we definitely welcome that. But I love this presentation because it was chock full of data, not a bunch of intentions that you had, not a bunch of things where you were going to be making guesses about things, but stuff that really is not only working, but has evidence of working. So let's start with maybe one of the hardest questions, and that is, which are the patients, do you think, Emily, that are the hardest to activate, regardless of whether you have digital or not? Because what we're seeing is, especially that number that you showed from 60% to 80% or 80+% engagement, there's still, the north of the 80% that are still not going to get engaged somehow. So let's start there. Who are the hardest ones and why, in those cases, do you think that they're hard to activate, even digitally?
Thank you. I think that's a good question. So I think it varies. I think we have to look at it the way the world is advancing now with technology and how many things are thrown at patients across their care continuum and then just in their own real lives. You might have a patient who gives us their work phone number, but they're only at work 8 to 5. You might have someone that gave us a cell phone number that's no longer in use, or they moved and forgot to update their phone number with us, or maybe we had a human or computer error where we might have mistyped the person's information where we put it in. So there's always definitely different pieces. I think one of the most exciting things about as we move forward with Emmy and other processes in place at UAB is expanding to text messaging. So I hope that through offering email, phone calls, and text messaging that we're able to reach greater beyond that 80% of patients. But I think meeting the patient where they're at in a way that they want to be met, in a way that's not overwhelming, is kind of the key to utilizing this process. Is you don't want to send them, 5 text messages a day. You want maybe 1 a week. So really identifying what is the appropriate amount that a patient wants to receive information from their healthcare provider is the important piece.
Yeah, and it sounds like what you're suggesting is based on the fact that whether you go out with them with text or any others, it seems like the requirement of making sure you have a proper phone number, proper email, et cetera, which we all try to do, but don't always end up prioritizing. So it sounds like one key lesson here, especially that you're sharing with us, is, hey, everybody, before you go spend a lot of money on a whole bunch of digital and other things, how about just do some simple blocking and tackling and making sure that your contact information is up to date? And what's interesting is, Walter's Kluwer, of course, as the group that builds Emmy for you guys, could also be used for helping to maintain and update those contacts. So it looks like these are orthogonal issues, but if you can get the contact information updated, seems like Emmy and these other products will do much better as well. I also found it interesting, Emily, you mentioned that you saw a lot fewer cancellations using Emmy, and I think it was a case study number 2. I found that interesting because I wouldn't have connected cancellations with engagement. All right, tell us a little bit about, was that a surprise to you guys, or how did you feel the engagement mattered in terms of cancellations?
Right. I think it was actually a very pleasant surprise. I'm not sure we expected to see that with quite so much significance, but it is wonderful to know that reaching out to patients and saying, hey, this is what's happening in your healthcare journey. This is what you can expect. These might be some good questions to ask your doctor, really getting the patient's buy-in and how they can engage with their own providers to take back to themselves. And especially in being able to expand not just to the patient, but to their caregiver and loved ones, really can inspire them to engage their own self-care journey. We want the patient to think about, why is this good for me? Why are they sending this to me? We don't want them to feel overwhelmed, but in the example with endoscopies and colonoscopies, everyone, you probably think, oh, I probably need a colonoscopy at some point. But these gentle reminders are a good way to say, hey, your doctor has recommended this for you, or you've reached an age where it's recommended overall that you might need something like this. It's something to be thinking about. And I think in getting patients thinking about what their medical journey needs to look like right now really inspires them to continue looking at to ask those big questions and saying, is this right for me? Is this something I need to do now? But with that, having all that information out there, I think patients have more buy-in. And with that buy-in, they say, okay, I'm ready to do this. Let's knock it out. All of my questions have been answered. I feel educated about the process. I'm ready to come back to UAB and have whatever procedure done.
Yeah, and it sounds like a couple of key learnings here are that by staying in contact with the patient, now you didn't mention the cost savings associated with that cancellation reduction, but it's significant, right?
Yes.
Whether it's a fee for service or just rescheduling everything and making sure that proper utilization gets maintained, it's substantial. And so we're talking about easily hundreds of thousands of dollars potentially in cost savings. But more important than that is the increase in the trust that the patients now have with UAB. So talk about that a little bit. Is if you get this digital stuff right, if ME does its job properly, what is that trust worth? And then once you've gained that trust through this means, what else could you do with these patients with now that increased trust? Because I think it was increased trust which reduced the cancellation, right? Because they trusted you guys to say, okay, this probably is important, so let me go ahead and come in, rather than just saying, hey, I don't understand what all this is about. So what else do you get if you can build that trust?
Right. I think in engaging with our patients, we really want to encourage them on that self-care journey, but in providing them education in a more preventative way, we think we're able to better connect with those patients. Patients don't want to have bad news. They want to have, hey, this is what we can do to prevent future bad news. So anything we can do to really make sure that we're connecting with the patient at that right time, in that right place, in the way that they want to be connected with is going to benefit us. So in connecting for colonoscopies, we're reaching out multiple times throughout the year. We have the colorectal awareness month that we can reach out to patients, but we want to be engaging with them in order to make sure that they know, hey, we might be physicians, but we care about you. You know, your nurses care about you, your staff cares about you. And for things like the transition program that's following those patients, you have a real life nurse that's going to call you back and make sure that whatever issue you said, we're following up on that. We are here for you across your care journey, and we want to make sure that we're engaging with you in a way you want to be engaged with.
Yeah, I love that. In fact, as you started to talk about the second and third case studies, you honed in on one key important fact, and that is that the staff were able to spend more time on the things that are most useful to patients rather than a bunch of administrative kind of things. You didn't mention the word that we're hearing about quite often, which is a burden reduction or burnout. So could you talk, are you able to make any guesses or think about whether this really helps with staff burden reduction, or does it just shift the burden? And if it does help with burden reduction, does it also help with burnout reduction, or was that not something you guys noticed much at all?
It is something we track. So it's something that I find really interesting. So I have a team of 5 nurses currently that work under me, and they are the ME transition nurses. Their whole role is to respond to those patients who received a call series, report a red flag, and then my team goes and responds to them. So they're each specially trained for whichever area they might be responding to, be that heart failure, diabetes, COPD, pneumonia has been a big one over the last couple of years with COVID. We also see that COVID-induced pneumonia. And so through those programs, we're able to respond to patients for however they want to. So with the call series, the way that works is we can automate through the system using PowerChart. It's also workable for Epic if anyone uses Epic. So everything is fully integrated. If you put in a diagnosis code or do something with a location, you can track those patients. And then from there, you can fire off the call series. You can fire off the ME Engage education, whatever you need to do to connect with that patient back, but you are following them through that journey. So then it gets back to our nursing staff. And so instead of your nurses spending, 8 hours a day calling however many patients numbers they can get through, you have a computer system that is doing this all for you. We have really taken the heavy burden off of the nurses and given them just the work that they need to be doing, which is talking and connecting with patients to make sure that they know we care about them and we're getting to them as fast as we can. We don't want you to receive a phone call and then get a phone call from a nurse 5 days later when your issue might have gotten worse. We want to be there and be able to escalate you to wherever you need to go.
Right. And at this point, this program that you were studying did not incorporate email and text. And so almost all the value you're getting at the moment is just, regular old plain old phone calls at the moment. What do you feel will happen as you get more digital and text and other things going?
Right. So I do, I guess, need to have a correction. So we are using Emmy Engage, which is an email-based platform. So
It is.
that's
Okay.
what is used through that smart computer software where you need a smartphone device or an iPad or anything like that. But we are currently working on text messaging, so I'm very hopeful that that will be coming out the next month or two. But I'm very excited. I think as technology has grown and as people have become more adjusted to what kinds of technology are out there, especially with different generation gaps, I think some of our younger people don't want to necessarily answer a phone call, especially if you're at work, you miss your phone call. It's not a big deal. We're going to attempt to call you again through the automated software. But with a text message, you can respond at any point throughout the day. And then same thing, a nurse can call you back same day or next day because you engaged. So I think it's going to be a wonderful thing. I think technology really opens the door to be able to connect with our patients. It's just making sure that they know that this is there for them and that we're here for them at UAB.
No, perfect. And the education material that I think it was in your first or second case study that you mentioned, the graphics you showed about the colonoscopy and explaining things in advance, are those standard already produced materials that Emmy is giving you with the package, or does UAB have its own custom materials that you're using with your own doctors and nurses and stuff on it? And just talk about that, and then I'll ask you a further question based on that.
Great. Thank you. That's actually a really good question. So you have the option of doing both, or we utilize both at UAB. So Emmy has a wonderful platform. They have this program called Try Emmy, where all of their education lives. I think there's over 400,000 documents on it. It's some crazy number. You can find something about anything you're looking for. But Emmy is really good to work with. Is anything a team brings to me and says, hey, I need a video on this thing. Is that something you have, or is it something you're working on? And I can say, hey, I can see that's in the list, or yes, I have that for you. I'll put it into the system. You can start using it today. And then at UAB, certain physicians want to do things their way, as I'm sure you can imagine. So if they have anything particular, they're able to go through our marketing department, create their own video, and then Emmy can host that for them. So it works the same way, just a little bit more legroom for UAB where they can create what they want to, and we're able to share that.
Perfect. And what I was going to add to that was, is there anything that you guys have noticed in terms of the data that you might have or that you might explore in the future? Does it matter to the patients whether or not their personal physician or physicians from their university, in your case, your institution, are there? Or hey, as long as the information is good, they don't find any big difference between the personalized education versus the non-personalized one? Any guesses on about that?
Right. I think it varies. I think some patients might prefer to see their loving doctor's face, but most of the time, it seems like everyone is just happy to have the education at their fingertips. I think having easy access in a simplified format, all of the education is at about a fifth grade literacy level, so Emmy really makes it easy to understand. And I think just through the ease of use, the ease of understanding, the ease of access, that really does just kind of nail it for our patients. I think it's a good thing for them.
Perfect. And just as a last question, I know we're running out of time almost. Talk to us a little bit about what are some ways that you think that many organizations, like if you were about to do this again, you've gotten some success out of it. What would you differently based on what you've learned? And did you have any myths or misconceptions about what you're about to get into? Any advice for people who are about to get into this about what you might do differently if you were to do it again?
I think fully integrating earlier. Let's say, so we've had several systems, I'm sure as everyone at a hospital knows, is some people know about something, some people know about something else, and then no one understands what everything does. So I think getting out there to every single physician team, every service line, saying, hey, Emmy is here. Emmy has all these things available for you. This is what we can do for you. I think that's been one of the biggest challenges that I wish we had done a little faster, a little earlier, just to compete. But really, it's such an overarching system with so many amazing points, especially with all the different technology formats that it uses and brings everything together. It's a great program.
Yeah, perfect. And my just concluding remarks would be, this is not one of those things where you say, hey, should we do it or not? Of course you have to do it. You have to go digital. You have to go engaged. You have to put all these tools in. And I really love that advice, Emily, that you gave is don't half-ass it. Go all the way in, get
Yes.
your integrated model going. And the other advice everybody should take from Emily is get your contact numbers and everything in order beforehand. Because if you have bad data in your contact databases, this process is not going to be as nice as that Emmy has turned out for the university where she's at. But this was fantastic. Thank you so much, Emily, for sharing all your partnering with patients advice. And we look forward to you in our next session, everybody.
Thank you so much.